Stroke Check is an educational primarily and screening program related to stroke that we started in 2001, and over the subsequent years it's become a major stroke educational program throughout Arizona. Currently there are approximately 26 hospitals throughout Arizona providing the Stroke Check program throughout the month of May. Throughout Phoenix and Tucson areas. And over the years since 2001, over 25,000 people have run through the program. The main focus is to educate people about stroke. And so what do we need to educate them about? We educate them about the risk factors and risk factor modification, warning signs of stroke, and 911 emergency service. There are very many risk factors that increase your risk of stroke, and they're very similar to the same risk factors for heart disease and heart attack. High blood pressure is probably the most common of all the abnormalities throughout society, and because it is so ubiquitous, so frequent in society, it is one of the most important things raising your risk for stroke. Smoking is probably the worst thing you can do. It corrodes your blood vessels from the inside. As an angiographer, in my lifetime in radiology, I have seen the effects. I can see the vessels and say this person was a smoker, because it just basically corrodes the blood vessels. Instead of a nice smooth tube where blood flow is going, it's like a corroded pipe. There are other risk factors for stroke that are not modifiable, which means that there's nothing you can do about them. So being male, being African American, some of those things, there's nothing you can obviously do about that, but they will raise your risk for stroke. Vision loss in one eye, weakness in one side of the body, face, arm, or leg, right or left side, but usually on one side of the body, and abnormal speech, unable to understand speech, unable to speak, or garbled or nonsensical speech. And then other less common or specific things such as a severe headache, frequently described as the worst headache of your life, or confusion or inability to walk or have normal balance. About 15 to 20 years ago, my grandmother living in Florida, she fell, bruised her body, and during the time when she was recovering, her doctor took her off her Coumadin, which reduces your risk of stroke to a more normal of the general population. While she was off the Coumadin, she had a major stroke and she passed away. And that was unfortunate, but that gave me a passion for stroke. If you don't know the warning signs of stroke, you're unlikely to realize a stroke is happening, and therefore you're unlikely to call 911 immediately and get the person over to the hospital. There is a very short window of opportunity during the time the symptoms of the stroke begin and the time medication has to be initiated in order to reverse these symptoms of the stroke, and to reverse the stroke in order to return you to your normal level, and to have any opportunity of returning to where you were before and to save yourself.